Hi, this is Steven, and today we will be continuing our discussion for our lecture series in human anatomy and physiology. And this is the integumentary system. When you meet someone for the first time, your first impression would be based largely on the physical characteristics, the most visible parts of the body, and its associated features. And for example, the distribution, color, the length, the health, and the age of your new acquaintance will be the basis of it. And you might also note some of these freckles like in the skin, moles, and the pigmentation differences. And when you are cold, you develop goosebumps. Your hairs stand on the end. And if you are hot, nervous, or sweat, most of us are so conscious of these first impressions that we have expended considerable time, money, and effort in our daily grooming. And these rituals will be very important as we put our best face forward. And in this lesson, we are going to answer the questions like, why are there different colors and textures of skin? What is a freckle? What is a blister? What is a callus? And why is the skin thinner in some areas of the body than in the others? What are fingerprints? How does hair grow, and what makes it curly and or straight? Why does it turn gray? And these are just a few questions that you will be able to answer as we learn about the structure and the functions of the important body system, the integumentary system. Did you ever wonder why it's so difficult to save the life of someone with has this extensive third-degree burns? Are you familiar with burns? Yes. So we will be looking at the layers of the skin as we progress with our lesson. But before that, let me present to you the contents of this integumentary system. First, we will talk about the structure of the skin, the epidermis, the dermis, the blood supply of your integumentary system, the subcutaneous layer or the hypodermis, the accessory structures of your skin, such as the hair, skin glands, and nails. What are the types of skin? What are the functions of your skin? The development of the integumentary system, and aging and the integumentary system. In the first section, we will be defining integumentary system. We describe the layers of the epidermis and the cells that compose them. We compare the composition of the papillary and reticular regions of the dermis, and you have to explain the anatomical basis of differences in skin color. By the way, what is the integumentary system? Integumentary system means the whole body covering. Okay, it's composed of the organs such as the skin, the hair, the oil, and the sweat glands, nails, and some of the sensory receptors. It is helping us maintain a constant body temperature, protecting our body from pathogens. At the same time, it provides sensory information about the surrounding environment around us. Of all these organs in your body, none is more easily inspected nor more exposed to infection, disease, and injury than the integumentary system. So we're trying to look at the functions of your integumentary system, and later in the middle of this discussion, we will be looking at the full explanation for these functions. Functions of your integumentary system is regulating your body temperature. It stores your blood, protects the body from external harm, defends cutaneous sensations, excretes and absorbs substances, and it creates or synthesizes your vitamin D. When we say these functions, attributing to that will be your changes in your skin color may indicate some homeostatic imbalances, an imbalance in your homeostasis. Like abnormal skin eruptions or rashes may reveal again some systemic infections or diseases of your internal organs. And to further study or to further focus on this specialized field in medicine, we have this what we call as dermatology, which is a medical specialty that deals with the structure, the function, and the disorders of your integumentary system. That's dermatology. And in the structure of your skin, okay, this is your the structure of your skin. Skin is also referred to as a cutaneous membrane. Okay, it covers the external part of your body, and it is the largest organ in your body. In adults, the skin covers an area of about like 2 square meters. That's 22 square feet, and it weighs 4.5 to 5 kilograms. That's around 10 to 11 pounds, and about 7% of your total body weight. It ranges, okay, this sectional view of the skin, it ranges in thickness from 0.5 millimeter or 0.02 inches, and on the eyelids to 4 millimeter or 0.16 inches, and on the heels it varies. However, most of your body, it is in 1 to 2 millimeters. That's 0.04 to 0.08 inches deep. Structurally, the skin consists of two parts, your epidermis and your dermis. So the skin again is consisting of a superficial thin epidermis and a thick dermis. Deep to the skin is your fat layers or subcutaneous layers, which are attaching the dermis to the fascia of the body. These two images will show you a sectional view of your skin, and we have here the epidermis, the papillary region, and the reticular region of your dermis, the sebaceous glands, the hair root, and hair follicle. And on the right side, this is the sectional view of your dermal papilla, these epidermal ridges and epidermal layers. Starting off on the superficial, the stratum corneum, next the stratum lucidum, stratum granulosum, stratum spinosum, and stratum basale, the epidermal ridges, and the corpuscle of touch and dermal papilla. And we will be looking at the functions of these epidermal layers in the next few slides. On the other hand, this is a epidermal ridges and sweat pores. Okay, this is a fingerprint, and this is your a scanning electron micrograph photo of the epidermis and the dermis. Before we move ahead with the next few slides, I have this guide question. What types of tissues make up the epidermis and the dermis? You're right, the epidermis is composed of an epithelial tissue, and the dermis is made up of connective tissues. In the first feature of clinical connection, this is all about skin grafts. What are the skin grafts? So technically, new skin cannot regenerate if an injury destroys a large area of the stratum basale, that's the deepest part of the strata of your epidermis, and also its stem cells. Skin wounds of this magnitude require skin grafts in order to heal. What is a skin graft? A skin graft involves covering the wound with a patch of healthy skin taken from a donor site to cover a wound. So this photo on your right is a skin graft on leg trauma, like some 5 days after surgery, and the take and healing aided by your VACs. Next feature for the skin grafts, okay, skin graft is also performed to protect against fluid loss and infection, and it also promotes tissue healing. It also reduces scar formation and prevent loss of function. And for cosmetic reasons, skin graft is also being done. To avoid tissue rejection, the transplanted skin is usually taken from the same individual, autograft, or an identical twin, or the isograft. If the skin damage is so extensive that an autograft would cause the harm, a self-donation procedure called autologous skin transplantation may be used. And this is a device, we call it the dermaclose, which is used to help close the large wounds as an alternative to skin grafting or in conjunction with a skin graft, as in this patient's case. In continuation, the structure of your skin has different cell types, and the epidermis, besides the keratinocytes, it contains melanocytes, which produces the pigment melanin, intraepidermal macrophage cells, which participate in immune responses, and tactile epithelial, or we call it the Merkel cells, which are functioning in the sensation of touch. This is more likely to have works in your somatosensory system, the fine touch, deep touch, okay, receptors found in your skin. An important molecule that are found in your melanocytes are the melanin. Melanin is a yellow or red or brown or black pigment that contributes much to the skin color of an individual, and it absorbs the damaging ultraviolet rays from the sun. And once inside the keratinocytes, the melanin granules, okay, cluster to form a protective veil over the nucleus on the side toward the skin surface. In this way, they shield the nuclear DNA from the damage brought to us by the UV lights. Although the melanin granules effectively protect the keratinocytes, melanocytes themselves are particularly susceptible to damage by UV light. So that's why when you have lighter skin, you are susceptible to burns, okay, sunburns. And when you have a darker skin, then you have an extra protection against these harmful UV rays. Alright, this is the next question. What is the function of your melanin? You're right. Melanin protects the DNA of the nucleus of your keratinocytes from being damaged by the ultraviolet rays of light. For these layers of the epidermis, again, it is consisting of keratinized stratified squamous epithelium. And there are 4 principal types in epidermis of your thick skin. This is your stratum corneum, lucidum, granulosum, spinosum, and basale. So these are your dead keratinocytes. They shut off your lamellar granules, the keratinocytes, intradermal macrophage, which is for immunity, tactile epithelial cell, tactile disc, sensory neuron, and your melanocyte. And on the next layer of the skin, or the deep layer of the skin, is your dermis. Next question. Which epidermal layer includes stem cells that continually undergo cell division? Very good. It's the stratum basale. This is the layer of your epidermis with stem cells that continually undergo cell division, the borderline between your epidermis and the dermis. So again, using this table 5.1, we are trying to make a summary of your epidermal strata. For the deepest layer, it's composed of a single row of cuboidal or columnar keratinocytes that contains scattered keratin intermediate filaments. We call them tonofilaments. And these stem cells again are undergoing cell division to produce more keratinocytes, melanocytes, and tactile epithelial cells, which are associated with tactile discs that are scattered among the keratinocytes. In your spinosum, it's referred to as spinosum because the portions, okay, or the cells from this layer or strata is resembling like a spine. 8 to 10 rows of many-sided keratinocytes with bundles of keratin intermediate filaments contains arm-like projections, okay, of melanocytes and intraepidermal macrophage cells. Granulosum, it has 3 to 5 rows of flattened keratinocytes in which organelles are beginning to degenerate. Cells contains the protein keratohyalin, which converts the keratin filament into keratin, and lamellar granules, which has releasing a lipid-rich water repellent secretion. So your skin is a water repellent because of these lipid-rich, secreting lamellar granules. Lucidum is only present only in the skin of your fingertips, palms, and soles, and it consists of 4 to 6 rows of clear, flat, dead keratinocytes with large amount of orderly arranged keratin. So if you notice, your fingertips, palms, and soles are the thick skin. It's only present, lucidum is only present on those parts. And to discuss more on the differences between the thick and the thin skin, we will be looking at the differences, comparison, and contrasting these two in the future slides. And on the superficial part, the corneum, which is 25 to 30 rows of dead flat keratinocytes that contain mostly of the keratin. Before we move ahead with the next subsection, we have this checkpoint to answer. First, to define integumentary system, describe the types of cells found in the epidermis and explain their functions. List the distinctive features of the epidermal layers from the deepest to the most superficial. In some of the regions of your body, collagen fibers within the reticular regions of the dermis tend to orient more in one direction than another because of your natural tension resulting from the bony projections, orientations of muscles, and movements at joints. So, this concept or this idea of tension lines or the lines of cleavage in your skin indicate the predominant direction of an underlying collagen fibers. Again, collagen is a protein that's abundant in your body, and they are the ones which is responsible for the strength or the texture of your skin. Tension lines in the skin indicate the predominant direction of underlying collagen fibers in the reticular region. So this is the anterior view and posterior view of the following tension lines. For our next guide question, why are tension lines clinically important? You're right. Tension lines are clinically important because surgical incisions parallel to them will leave only fine scars, but a surgical incision made across several tension lines, will tend to heal in a broad, thick scar. So the incision is placed along these lines will produce a very inconspicuous scars, and as well as orienting the excision correctly, tension can also be minimized by undermining or separating the superficial subcutaneous fat from the underlying soft tissues and using relaxing incisions to distribute tension over a greater area. Our next clinical connection would be stretch marks. Because of the collagenous vascular structure of the dermis, striae or stretch marks, a form of intrinsic scarring, can result from an internal damage to this layer. Again, the dermis is a vascular layer, means to say it is a structure that is composed or provided of more blood vessels. When the skin is overstretched, let's say in pregnant women, the mechanical demands placed on this layer exceed the strength of collagen bonding and the stretch available from both the elastic fibers and the creases in the skin. So this is an example of a stretch marks on the abdomen of an obese adult male, and it's not limited to this abdominal pelvic region. It also has in your lower limbs and arms. So to put it in summary, between papillary and reticular regions of your dermis, again, try to look at the anatomy of the dermis. The papillary region is the superficial portion of your dermis. It is consisting of areolar connective tissue with thin collagen fibers and fine elastic fibers, which contains dermal papilla that house blood capillaries, corpuscles of touch, and free nerve endings. And reticular region is about a deeper portion of your dermis. It's about 4/5, consisting of dense irregular connective tissue with bundles of thick collagen and some coarse elastic fibers. The spaces between the fibers are containing some of your adipose cells, the fat cells, hair follicles, nerves, sebaceous glands, and sudoriferous glands. Our next clinical connection will be a disorder, we call it albinism. For albino individuals, albinism is an inherited inability of an individual to produce melanin, and most albinos, people with affected with albinism, their melanocytes are unable to synthesize with the enzyme tyrosinase. Melanin is missing from their hair, their eyes and skin, and this results in problems with vision and a tendency of the skin to burn easily from too much overexposure to the sunlight. This is a girl with albinism in Cali, Colombia. Again, this is an inherited disease. Next, this connection will be your vitiligo. This vitiligo is a partial complete loss of melanocytes or from patches of skin that produces these irregular white spots. The loss of melanocytes is related to an immune system malfunction in which antibodies are attacking these melanocytes. This is a UV photograph of a hand of a patient with vitiligo. Another famous person in the name of our king of pop, Michael Jackson, has this condition. Skin color is also used in diagnosing or as a diagnostic clue. The colors of skin and mucous membranes can provide clues for diagnosing certain conditions. So the first is your cyanosis. You can see it in the hand of the patient when they have low oxygen saturation. When blood is not picking up an adequate amount of oxygen from the lungs, as in someone who stopped breathing, the mucous membranes, nail beds, and skin appear bluish, or it's referring to as a cyanotic from the word cyan, which means blue. That technically is for the low O2 saturations. For another color, it's called the jaundice. It's a buildup of the yellow pigment bilirubin in your skin. This condition giving us a yellow appearance to the skin and the whites of your eyes. It's usually indicator of a liver disease or something works in the accessory organs of your digestive system. A photo on your right is a person with jaundice diagnosed with pancreatic cancer. Erythema is a redness of your skin. Okay, it's caused by engorgement of capillaries in the dermis with blood due to skin injury, exposure to heat, infection, inflammation, or allergic reactions. This reddish tint also appears in facial blushing, with the relatively thin skin of the face fills with blood during a moment of embarrassment. This is more common for people who has lighter skin flushes. Pallor or paleness of skin may occur in conditions such as shock and anemia. Certain regions of your skin, such as the lips, have a thin stratum corneum that the blood-filled capillaries in the underlying dermis show through, giving a skin a permanent reddish tint. This young girl on the right is having a circumoral pallor. Okay. Also, skin color changes are readily in people who have lighter colored skin. Again, it may be difficult to discern in people of color. However, examination of the snail beds and gums can provide some information about the circulation in individuals with the darker skin. Before we proceed, we have following checkpoints. What are the three pigments in the skin and how do they contribute to skin color, and how do albinism and vitiligo differ? On the next part, we will be learning about the accessory structures of your skin. Compare the structure, the distribution, and functions of hair, skin, glands, and nails. The accessory structures, such as the hair, skin, glands, and nails, develop from the embryonic epidermis, and among their most important functions are the protection of your body by hair and nails, and sometimes regulation of body temperature by the sweat glands. This is the human hair. Human body has a dense covering of hairs, or what we call as your pili, but they are not as numerous as hairs of the skin of other mammals. So the distribution of hair technically is varies approximately from 600 per centimeter squared on facial skin, okay, to 60 per centimeter squared on the skin over the rest of your body. The hair shaft here, you can see this the superficial portion of your hair, most of which protects from the surface of the skin. So you will see here the hair shaft, the hair root, erector pili muscle, okay, acrine sweat glands, sebaceous glands, the bundle of smooth muscle cells like this erector pili muscle again, hair root plexus, hair bulb, papilla of the hair, apocrine sweat glands, and some of the vascular region of your subcutaneous fat or the blood vessels from the dermis. And each of these hair is composed of columns of dead keratinized epidermal cells which are bonded together by some of your extracellular proteins. And the hair root, you can see here, is a portion of that hair deep to the shaft and that penetrates to the dermis. This is the reticular region of the dermis. And sometimes it will also reach to the subcutaneous layer. The shaft and root both consist of 3 concentric layers. You will see that one in the previous slide. Surrounding the root of the hair is what we call as your hair follicles. This one. They are made up of external root sheath and internal root sheath. This is the dermal root sheaths. On the next clinical connection, this is the hair removal. A substance that removes hair is called depilatory. It dissolves the protein in the hair shafts, turning it into a gelatinous mass that can be wiped away. Because the hair root is not affected, regrowth of the hair occurs. And electrolysis, an electric current is used to destroy the hair matrix so that the hair cannot regrow. And there are some treatments in the use of laser that may also be used to remove the hair. These are the distribution of the major and minor. That means to say it's more the darker one has the darker color indicates excessive growth of these hair and hair follicles, and on the lighter color brown is minimal amounts. Okay, so there's also a condition we call as your alopecia, and we will discuss that one later. It's partially complete or partial lack of hair, and this may result to some of the factors like genetics, aging, endocrine disorders, chemotherapy for cancer, and or skin disease. And before we go ahead with the next clinical connection, there is a question here. Why does it hurt when you pluck a hair but not when you have a haircut? You got it. Plucking a hair is stimulating hair root plexuses in the dermis, and some of which are very sensitive to pain. Again, you remember the pain receptors found in your dermis, because these the cells of a hair shaft are already dead, and the hair shaft lack nerves. Cutting hair is not painful when you're having a haircut. Next will be a clinical connection in your chemotherapy. Chemotherapy is a treatment of disease, usually by cancer, and this means of chemical substances or drugs. These chemotherapeutic agents interrupt the life cycle of rapidly dividing cancer cells. Unfortunately, this also affects other rapidly dividing cells in your body, and such as your hair matrix cells. It is for this reason that individuals or patients are undergoing chemotherapy experience hair loss. The photo on your right is two girls with acute lymphoblastic leukemia receiving chemotherapy. And look at their hairs. Next clinical connection will be looking at the hair and hormones. And we'll try to differentiate the males and females. Okay? At puberty stage, the testes begins secreting a large amount of androgens, or what we call as masculinizing sex hormones, and males typically grow or typically develop hair growth in some patterns that includes a beard and a hairy chest. In females at puberty, the ovaries and adrenal glands produce a small quantity of androgens, and which promoting the growth of coarse hairs in your axilla or the armpit and the pubic region. Occasionally, when there is a tumor in your adrenal glands, it produces an excessive amount of androgens, and resulting in females or prepubertal males as hirsutism. This is an excessive body hair or hairiness in areas that are not usually hairy. This photo on your right side is a photo of a bearded lady named Annie Jones, taken by Charles Eisenman in around 1900s. Baldness also is a more common occurrence. In common form of baldness, we call it androgenic alopecia or male pattern baldness. In some of the genetically predisposed adults, androgens again inhibit hair growth. In men, hair loss is usually followed by a receding hairline, okay, and hair loss in your crown and your temples in this region. Women are more likely to have a thinning on the hair on the top of their heads. Thus, there is a drug being approved to enhance scalp hair growth. This is named minoxidil, and it causes vasodilation or widening of blood vessels, thus increasing circulation. It's directly stimulating your hair follicle cells to pass the growth stage follicles, and it inhibits the androgens. In about a third people who tried it, minoxidil again improves hair growth. And for many people, however, the hair growth is still a problem because minoxidil does not help people who are already bald. We are presented right now with the histology images of your skin glands, and we need to differentiate your sebaceous glands versus your sudoriferous glands. And so your sudoriferous glands, again, it operates two different sweat glands, your eccrine sweat glands and your apocrine sweat glands. Your sebaceous glands, or because it's from the root word sebase, which means greasy, okay, it is also named as oil glands. They are simple, branched, okay, acinar, it's rounded, you see it in the photo, glands, and few exceptions, they are connected to the hair follicles. On the other hand, your sudoriferous glands, okay, there are a lot of them, 3 to 4 million. Okay, there are sweat-bearing glands in your body, and the cells of these sweat glands release their secretions by exocytosis, and emptying them into the skin surface through pores or into the hair follicles. And it depends on the hair type or structure of secretion. These glands could either be eccrine or apocrine. In your eccrine sweat glands, Again, it secretes outwardly, also called as your merocrine sweat glands. They are simple coiled tubular glands. They are more common than apocrine sweat glands. However, they are distributed again throughout the skin of the most parts of your body, except for the margins of your lips, nail beds, your fingers, your toes, your glans penis, your glans clitoris, labia minora, and also your eardrums. Your apocrine sweat glands, okay, it's separated from, okay, secretion, a second type of sweat gland which is also active during emotional sweating. Like eccrine glands, they are very simple coiled tubular glands, but they have larger ducts, okay, compared to eccrine. Apocrine has larger ducts and lumens than the eccrine sweat glands. They are found mainly in the skin of your axilla, your armpit, your groin, okay, your areola, the pigmented regions on the breasts, and the bearded regions of the face in adult males. Before we go ahead with the next clinical connection, there's a guide question here. What is the main function of your eccrine sweat glands? Very good. The main function of your eccrine sweat glands is to help you regulate body temperature through evaporation. Another clinical connection here is your acne. Acne is an inflammation of your sebaceous glands that usually begins at puberty. When the sebaceous glands are overstimulated by androgens, it occurs predominantly in sebaceous follicles that have been colonized by bacteria, some of which are thriving in your lipid-rich sebum. This infection may be caused a cyst or a sac of connective tissue cells to form, which can destroy and displace epidermal cells. And this condition is what we call as your cystic acne, which can permanently scar your epidermis. This is a photograph of an 18-year-old male with moderate severity of acne vulgaris, demonstrating classic features of whiteheads and oily skin distributed over the forehead. Now, these are the summary of your sweat glands. Their distribution, okay, their location of secretory portion, termination of excretory duct, secretion, functions, and onset of function. All of these are in this summary. Again, sebaceous are in dermis. They are connected to hair follicles. They secrete sebum. They prevent hair from drying out, preventing water loss from your skin, making your skin soft. And they are inactive during childhood and activated during puberty. Eccrine sweat glands are in the deep dermis. It's in secreting sweat in the surface of the dermis. It's less viscous. It's containing water ions, urea, uric acid, ammonia. It regulates body temperature as it releases sweat, and the function of it will be on soon after birth. Your apocrine glands are mostly in subcutaneous layer. They're terminating in the hair follicles. It has more viscous secretion, and they're stimulated during emotional stress and sexual excitement. And the onset of function is at puberty. And lastly, your ceruminous glands. This is found in the subcutaneous layer. This is more of the surface of the external auditory canals or in the ducts of your sebaceous glands, and they secrete cerumen, which is a waxy material, and this is impeding or stopping the foreign substances and insects into entering your external ear canals. And they are soon after birth. They are being onset of functions. Next will be your nails. Nail cells arise by the transformation of superficial cells of this nail matrix. Nails are plates of tightly packed, hard, keratinized epidermal cells. See here the structure. The cells from these form a clear, very solid covering over the dorsal surface of the distal portions of your digits. Each nail is consisting of a nail body, a free edge, and a nail root. These are the summary of the anatomy of your nails. Nail root is not visible. Eponychium is the stratum corneum of the epidermis. Lunula is the one that resembles like a moon. Okay, is the thick white part of the nail. The nail bed is where the skin below the nail plate. Nail body is the visible portion of your nail. Free edge is extending past the finger or toe. Hyponychium, it secures the nail to the fingertip. And the nail matrix is an epithelium proximal to the nail root, and it contains dividing cells that are producing new nail cells. This is the sagittal section in showing internal detail. This is a photomicrograph of your fingertip. Again, nail growth also varies with according to the season, the time of the day, environmental temperature, and in some of the cases, the average growth of the length of your fingernails is about 1 millimeter per week. The growth rate is somewhat slower in toenails. The longer the digit, the faster the nail grows. Just check your digits. Nails have a lot of functions. Again, protecting the distal end of your digits, providing support to counter pressure to the palmar surface of the fingers to enhance touch perception and manipulation, the picking of very small tiny substances, manipulating small objects, and they can also be used to scratch and groom the body in various ways. Our next guide question: why are nails so hard? Very good. Nails are hard because they are composed of tightly packed, dead, keratinized epidermal cells that do not shed and are filled with a harder type of keratin than in the epidermis. As we go ahead with the checkpoints, we need to describe the structure of the hair, what produces goosebumps, contrast the locations and functions of your sebaceous glands, sudoriferous glands, and ceruminous glands. Describe the principal parts of your nail. Now we're moving forward with the types of skin. In this lesson, we compare structural and functional differences in the thick and thin skin. We have two major types of skin, and they are recognized on the basis of certain structural and functional properties: your thin or hairy skin and thick or hairless skin. The greatest contributor to this epidermal thickness is the increased number of layers in the stratum corneum, and this arises in response to the greater mechanical stress regions of your thick skin. When you compare the thick and thin skin, so the following features: the distribution. In your thin skin, all of the parts of your body except for the palms, palmar surface of your digits, and your soles. For thick skin, areas such as the palms, palmar surface of digits, and soles. Epidermal thickness, it's around 0.10 to 0.15 mm for thin, and 0.6 to 4.55 mm for your thick. This is more likely to have a thicker because of your stratum corneum. Epidermal strata in your thin skin, the lucidum is essentially lacking. Thinner strata, spinosum, and corneum. In your thick skin, striatal lucidum is present when there is a thicker stratum, spinosum, and corneum. Epidermal ridges, lacking due to poorly developed and fewer and less well-organized dermal papilla. In thick skin, present, which is due to well-developed and more numerous dermal papilla organized in parallel lobes. Hair follicles and erector pili muscles, again responsible for your goosebumps, present in thin, absent in thick. Sebaceous glands, present in thin, absent in thick. Sudoriferous glands, fewer in thin, more numerous in thick. That's why your soles of your feet and your palms are sweating a lot compared to other portions of your body. Sensory receptors, sparser in thin, denser in your thick skin. Now we have the checkpoint. What criteria is used to distinguish thin and thick skin? Now we'll just have a review on the functions for your skin as we have described it in the first few slides, which is like thermoregulation. Okay, this is homeostatic regulation of your body temperature. They liberate sweat at its surface and adjusting the flow of blood in the dermis. And in response to high environmental temperature or heat produced by your exercise, sweat production of your eccrine sweat glands increases. The evaporation of your sweat from the skin surface also helps to lower body temperature. In addition, blood vessels in the skin, okay, dilate and become wider. Consequently, more blood flows through the dermis and increasing the heat loss from the body. In response to a very low environmental temperature, the production of sweat from your eccrine glands is also decreased. Again, when it's heating, it's increased. When it's cold, it is decreased. This is also to conserve the heat. Also, the blood vessels in the dermis of the skin constrict. They will become narrow and they decrease blood flow through the skin and thus reduces the heat loss in your body. In addition, skeletal muscle contractions generate body heat, especially when you are in a strenuous activity. Blood reservoir. The dermis housed to an extensive network of blood vessels that carry 8 to 10% of total blood flow in a resting adult. For this reason, the skin is considered as a blood reservoir. Protection. It protects your body in different ways. Keratin protects underlying tissues from microbes, abrasion, heat and chemicals, and the tightly interlocked keratinocytes resist invasion by your microbes. So, this is because of your lipids that are being released by the lamellar granules, and it inhibits the evaporation of water from the skin surface, thus protecting your skin against dehydration. They also retard the entry of water across the skin surface during showers and swims. The oily sebum from the sebaceous gland protects your skin and hairs from dying out and containing the bactericidal chemicals those substances that are killing the bacteria. Cutaneous sensations. They are sensations that includes tactile sensations such as touch, pressure, vibration, and tickling, as well as thermal sensations such as warmth and coolness. Another cutaneous sensation, pain, is also an indication of an impending or actual tissue damage. Next will be excretion and absorption. They have a small role in excretion, the elimination of your substances from the body, and absorption of the passage of materials from the external environment into your body cells. Despite the almost waterproof nature of your stratum corneum, about 400 ml of water evaporates through it daily. And lastly, we have the synthesis of vitamin D. This vitamin D requires an active precursor molecule in your skin by the UV rays in the light. So the UV rays will hit your skin, thus releasing and promoting the creation of vitamin D. Your enzymes in the liver and kidneys then modify this activated molecule, thus producing the calcitriol, the most active form of vitamin D. Calcitriol is a hormone that aids in the absorption of calcium from foods in your gastrointestinal tract into the blood, and only a small amount of exposure to UV light is required for this vitamin D synthesis. People who are avoiding sun exposure and individuals who live in colder northern climates may require vitamin D supplements to avoid vitamin D deficiency. We call it as rickets. Most cells of your immune system have vitamin D receptors, and the cells activate vitamin D in response to an infection, especially respiratory infections such as influenza or flu. Vitamin D is also believed to have a phagocytic activity and increasing the antimicrobial production of some substances by phagocytes and regulate immune response functions and help reduce inflammation. Now, in the development of your integumentary system, we will try to see the development of the epidermis, its accessory structures, and the dermis. So you've learned that epidermis is being derived from your ectoderm, okay, which covering the surface of your embryo. Initially, of the 4th week after fertilization, the epidermis consists of only one layer of the ectodermal cells. And at the beginning of the 7th week, letter B, okay, the seventh week of the single layer called the basal layer is formed. It divides and forms a superficial protective layer and flattened cells called the periderm. The peridermal cells then are continuously sloughed off, and by the 5th month of development, the secretions from sebaceous glands mix with them and with the hair to form this fatty substance called the vernix caseosa. These substances are covering the skin of the fetus, okay, from the constant exposure to your amniotic fluids in which it is bathed. In addition, your vernix caseosa is slippery and it facilitates the birth of the baby and protects the skin from being damaged by the nails. And about 11 weeks, the basal layer forms this intermediate layer of cells, which is found here. And the proliferation of the basal layer in your epidermis, so the stratum basale. And 11th week, okay, you can also see this neural crest, okay, that migrate into the dermis and differentiate into what we call as your melanoblasts. These cells come soon into your epidermis and differentiate into becoming melanocytes. Later in the first trimester of your pregnancy, it is intraepidermal macrophage which arise from the red bone marrow, okay, invade the epidermis, and these tactile epithelial cells, also derived from the neural crest, will be appearing in the epidermis in between 8 to 12 weeks. The dermis, on the other hand, is arising from the mesoderm, okay, from the lateral plate mesoderm, and the dermatome of somites also is arising from the dermis. You'll see here in the 14 weeks, there's the developing seborrheiferous glands, sebaceous glands, okay, and the hair bulb. In the 16 weeks, developing sebaceous glands, the hair shaft, and the papilla. In 18 weeks, you'll see the erector pili muscles are there, your epithelial root sheets, and it's more likely to develop in the hair shafts are developing, and at birth you can see the epidermal layers and the melanocytes present. So this question, what is the composition of your vernix caseosa? Very good. Vernix caseosa is consisting of secretions from your sebaceous glands which are slowed off peridermal cells and hairs. Now we're down to the last portion of the integumentary system series. This is aging and the integumentary system. We will describe the effects of aging on the integumentary system. In aging, collagen fibers in the dermis will begin to decrease in number. They will be stiffened, breaking apart, and disorganized into a shapeless, matted tangle. The elastic fibers also will be losing their elasticity, thickening to clumps and fray, and in effect, it's greatly accelerated in the skin of those who are smoking. Fibroblasts, which produce your collagen and elastic fibers, decrease in number, and as a result, skin forms the characteristic crevices and furrows, which we call as your wrinkles. Again, with the onset of an old age, skin heals poorly and becomes more susceptible to some of the pathogens such as skin cancer and pressure ulcers. Rosacea is a skin condition, okay, that is affecting mostly fair-skinned adults between the ages of 30 and 60. It is characterized by redness, tiny pimples, okay, and noticeable blood vessels, usually in the central area of the face. How are we going to treat them? Okay, we have several cosmetic anti-aging treatments that are available in the market to diminish the effects of aging or sun-damaged skin. These include the following: topical products. They bleach the skin to tone down blotches and blemishes or decrease fine wrinkles and roughness. Microdermabrasion. They using tiny crystals under pressure and remove the vacuum to the skin surface cells to improve skin texture and reduce blemishes. Chemical peels. Application of mild acid such as the glycolic acid to remove the surface cells to improve skin texture and reduce blemishes. Laser resurfacing. They use laser to clear up blood vessels near the skin surface, even out blotches and blemishes, and decrease fine wrinkles. Dermal fillers. Injections of human collagen, hyaluronic acid, calcium hydroxylapatite, polylactic acid that plumps up the skin to smooth wrinkles and fill in furrows. They are usually used in around the nose and mouth and between the eyebrows. Fat transplantation to insert the fat or inject the fat in some part of your body to another location, such as around the eyes. Okay. Botulinum toxin or Botox. This is a diluted version of the toxin which inhibits nerve impulse transmission to the skeletal muscles, which is technically the injection to the skin that paralyzes the muscles that's causing the skin to wrinkle. They paralyze it, especially here in the eye area. You can see here Dr. Braun performing a Botox injections at this Vancouver Laser Skincare skin. They'll reduce and eliminate frown lines, forehead creases. You can see here the crow's feet near the eyes and thick bands in your neck. Radiofrequency non-surgical facelift. Using radiofrequency to tighten the deeper layers of the skin of the jowls, neck, and sagging eyebrows and eyelids. Facelift, brow lift, and neck lift. Non-invasive surgery, which losing the skin and fat that is removed surgically and the underlying connective tissue, which are being tightened. This is a photo from Michael Schwartz. Okay. Temporal incision behind the hairline of your endoscopic mid-face lift. We call it the rhytidectomy. You can see here the shiny surface of a deep temporal fascia. The plane is being dissected into the orbital rim and connected to the mid-face, which is your subperiosteal plane created through sublabial incision. Sublabial incision again, through which the periosteum of the maxilla is elevated in an endoscopic mid-face lift. And lastly, the checkpoint for this series: what factors contribute to the susceptibility of aging to infection? And now we're heading to the last portion, the critical thinking questions in human anatomy and physiology. This is again a case-oriented questions which will stimulate your deep thinking and critical thinking ability in answering these open-ended questions. Let's start. For the first question, your 65-year-old aunt has spent every sunny day at the beach for as long as you can remember. Her skin looks a lot of a comfort, um, in a comfortable lounge chair, brown and wrinkled. Recently, her dermatologist removed a suspicious growth from the skin of her face. What would you suspect is the problem and its likely cause? Probably chronic exposure to UV light, which causes damage to elastin and collagen that promotes wrinkles, and the suspicious growth may be skin cancer, which is caused by UV photo damage to her skin cells. Question 2. Lindsay is partying with his friends on a cold winter night. The outside temperature is below freezing, but they are not wearing their coats when they step outside to smoke. They say they don't need their coats because they are drinking alcoholic beverages, which will keep them warm enough. You've learned that alcohol dilates the blood vessels in your skin. Do you think Lindsay and his friends have chosen an effective way to control their body temperature? Why or why not? Very good. The dilation of the blood vessels in the skin increases blood flow, which means more body heat will reach the surface of the skin and be radiated away. There's more heat loss in the atmosphere. Therefore, although they will feel warmer superficially, but the temperature will decrease. They should wear their coats. Courtney and her college roommate made travel plans to go Cancun for spring break. Neither one of them ever bothered to wear sunscreen, thinking that they would get a better suntan without it. When the women reached their 40s, they were both diagnosed with malignant melanoma. Why has the risk of developing melanoma doubled over the last 15 years? What is the prognosis for someone diagnosed with malignant melanoma or skin cancer? Very good. This is more, in part, the increased risk of melanoma is due to the depletion of your ozone layers, which absorbs some of the UV light in the atmosphere. But the main reason for this increase is that more people are spending more time in the sun. Malignant melanomas metastasize rapidly, or they spread rapidly and can kill a person within months of diagnosis. Fourth question. Your nephew has been learning about cells in science class and now refuses to take a bath. He calls, if all cells have a semi-permeable membrane and my skin is made up of cells, then why won't I swell up and pop when I take a bath? Explain this dilemma to your nephew before he starts attracting flies. That's a tough question. The surface of the skin is keratinized stratified squamous epithelium, and the keratinocytes are dead and filled with the protective protein, which we call as the keratin. Lipids and lamellar granules and sebum also form or function in the waterproofing effect. And the last question. People always say it's not the heat, it's the humidity. When complaining about summer weather, with regard to the integumentary system, why do you think people feel hotter when it's 95 degrees Fahrenheit and 95% humidity when it's 95 degrees and 30% humidity? Again, humidity is the amount of water vapor in the air. Let's go back to your earth science classes. The higher the humidity, the less evaporation can occur, which means that less cooling can occur. Therefore, people perceive the same temperature as hotter at a higher humidity. Very well said. Again, thank you so much for listening, and I hope you have learned something from our lesson for today. This is the integumentary system, and don't forget to like and subscribe to my YouTube channel. Thank you so much and stay safe.